how often have we looked at reels and decided how to go about fitness and lifestyle choices? To talk about this, we have Dr. Soumya Swaminathan with us. She is the chairperson of the MS Swaminathan Research Center. Thank you so much, ma'am, for being part of this. You spoke something very interesting on getting influenced by digital influencers, especially celebrities. A lot of us are guilty of doing that. What is your advice on who are the people that we need to trust online?
So I think when it comes to your health, particularly, you should be getting advice from trusted sources, that is doctors, nurses, and public health experts who actually are experts in the field and who can tell you what is good and what is bad. Unfortunately, what we see today is a trend where a lot of people are commenting on social media on health issues, whether it's vaccines or whether it's food and nutrition or whether it's remedies for common diseases or even rare diseases like cancer. And we've had many examples in the recent past where celebrities who have millions of followers on social media make statements which are not correct. They're not medically or scientifically correct. But that ends up influencing millions of people. For example, if you say that, I know someone whose cancer was cured by drinking a certain juice, that's a very dangerous statement to make because cancer is something that only an expert oncologist can. And nowadays there's lots of molecular diagnosis. You can actually get treated and you can get cured if you're detected in time. So early diagnosis is important rather than going for these kind of unproven remedies. Similarly, there are many social media influencers who give their views on vaccines, saying this vaccine is unnecessary or that vaccine should not have been given. They are not the experts, so they really shouldn't be commenting on it because it harms the government's immunization program. So I would like to see influencers talk about things that they know about, talk about things which can actually make people happy, communicate positive, good messages, and keep away from things which really need to be communicated by people who have the knowledge of the science.
And what are the examples? I know you talked about those posts that we see on cancer. Can you also tell us a little bit of? Can you give us some examples where things have gone very bad only because some people chose to follow certain celebrities on Insta?
So we know, for example, and this is an example from another country where there are many people who are vaccine skeptics, and I know that when I was in WHO and we were the COVID pandemic was there and vaccination programs were starting. I know that there were countries in West Africa where the population was so influenced by social media messages, negative messages on COVID vaccines, that only 2 or 3% of the population actually took the vaccine. And that, as we know, results in unnecessary deaths due to COVID and long COVID and things like that. So there have been, now we are seeing it with measles in the US and in many other countries. Measles is coming back because some few people have raised the doubt that the MMR vaccine might be linked to autism. There is absolutely no truth in this. There are a couple of influencers in India also who have tried to link MMR and autism. HPV vaccine, the minister just now spoke that Tamil Nadu is one of the first states to launch HPV vaccine for girls. This is wonderful because you can actually eliminate cervical cancer by eliminating HPV infection. Imagine how many women you're going to save from cervical cancer in the future. But again, there are skeptics who are, coming on and saying, this vaccine should not be given, and without any basis at all. So these messages actually do a lot of harm, to the community in general. And so we need more responsibility for individuals to speak, and we also need more public health experts who speak on social media and give the right message.
My last question to you, ma'am. Do you think that this also calls for regulation, or do you think that society needs to be made responsible?
So I think this is a good question. I think there needs to be regulation actually on social media, because I think one is where you spread misinformation and disinformation, and I think it should be flagged and they should be forced to take it down. The second, of course, is you also see a lot of misogyny, a lot of hate. And as a woman, I'm sure you've also experienced it. If you're on social media and you're a woman, you're sometimes at the receiving end of very hateful kind of posts. So that's another kind of negative thing of social media, but certainly disinformation needs to be taken down. So there needs to be regulation.